Happy Halloween, everyone. This week we are not going to have a live session. Instead, I've made this video quiz recording. So what you're going to do for participation points this week is watch this video. You're going to take the quiz that's linked to the video, and then you are also going to complete an activity that I'm going to show you. So you'll have to do both of those to get your full participation points this week. So week 3 is reimbursement coding and claim instructions. Prospective payment systems. A prospective payment system is a method of reimbursement in which Medicare payment is made based on a predetermined fixed amount. The payment amount for a particular service is derived based on the classification system of that service. For example, diagnosis-related groups for inpatient hospital services. So for diagnosis-related groups, or DRGs, they are grouping patient diagnoses, and they consider patient diagnoses, patient procedures. They lump those together and they put them into a DRG group, and they use that to base it for reimbursement for how much the hospital is going to get reimbursed for those services. So those are prospective payment systems. It says, in other words, PPSs establish predetermined rates based on patient category or the type of facility, and that's straight from your reading. What I want you to do for your activity, aside from completing the quiz here that's associated with the recording, I want you to research one of these prospective payment systems listed here. So you have a whole list of them, and what I want you to find on them is the name of it, what setting that prospective payment system was created for, what is the formula for calculating charges or payments in that prospective payment system, and then what services are covered under the payment system. So for example, I have the clinical laboratory fee schedule that I chose. It was created for hospital labs, physician labs, pretty much any medical lab uses this fee schedule for the labs. So their formula for calculating charges or payment in this prospective payment system: payment is the lesser of the amount billed, the local fee for a geographic area, or a national limitation amount for the HCPCS code. And then again here, what services are covered under this payment system: biological, microbiological, chemical, etc. Those are all services that are covered under the clinical lab fee schedule. So that's what I want you to do. You find that these 4 things for the prospective payment system that you choose to do research on. And you can send me an inbox message, a Canvas inbox message, an email, any of those, or you can post this on in the class chatter area to get your points. Just let me know if you post that there. And these are all the ones you can choose from, or any of these listed up here too. Okay. Hospital-acquired conditions. These are certain preventable conditions that have high cost, high volume, or both, and could reasonably have been prevented through the application of evidence-based guidelines. And that's straight from your reading. So some of these, what are some ones that we can think of? Well, I've got listed here foreign objects retained after surgery. Some other hospital-acquired conditions. We could do falls and traumas. These are things that occur in the hospital. They're adverse things that occur in the hospital that basically could have been prevented by somebody in the hospital, right? Some staff member, and they were not prevented. So they're a hospital-acquired condition. Some other ones, we've got surgical site infections. Some other common ones are surgery done on the wrong patient, wrong surgery done on a patient, and then wrong site surgery. Let me scroll up here. So these ones, the Joint Commission has really worked on reducing these rates in the past few decades here. they really worked on these wrong site surgeries. Some of the main ways to prevent these types of things are just marking patients like where the surgery site is going to be. So if it's the left side, marking the left side of the body. Just to prevent these mistakes from occurring, some easy ways to prevent them. And it also says Medicare does not reimburse hospitals for services related to these procedures. Why do you think that is? Well, I think the main reason is because it's the hospital's fault that those conditions occurred. They could have done something to prevent them from occurring. So that's why Medicare doesn't reimburse for those types of procedures. The next thing I want to talk about here is present on admission indicators. It says the POA indicator differentiates between patient conditions present on admission and those that develop during the inpatient stay. For example, the patient's admitted for diabetes follow-up. The diabetes diagnosis is assigned a yes indicator, or Y, because it was present on admission. They had the diabetes prior to being admitted to the hospital. The other options for reporting POA indicators are yes, no, not present at the time of admission, U, unknown, so documentation is insufficient to determine if it was a POA, and then W, clinically undetermined, so the provider was unable to determine if it was present on admission or not. Scenario 1 here, the patient's admitted to the hospital with a pathological fracture of the right tibia. During the inpatient stay, she developed an ulcer on her left hip. So we're going to assign the POA indicator for the fracture. She was admitted with a pathological fracture. We're going to say yes, that condition was present on admission because she was admitted with that condition. The second one here, the patient is admitted for a myocardial infarction that occurred while the patient was home. Patient was brought to the hospital via ambulance. Assign the POA indicator for the myocardial infarction. Again, they're admitted with that myocardial infarction. They had that when they were home. We're going to assign a yes POA indicator for that one. The third one here, I want you to answer this one. It says a patient is admitted with Crohn's disease and has an intestinal resection. After surgery, the patient is diagnosed with acute blood loss anemia due to the procedure. What is the POA indicator for the Crohn's disease diagnosis, and then for the acute blood loss anemia diagnosis? Okay, I'm going to move on here. The next thing I want you to do, we're talking about the National Provider Identifier. This is a unique 10-digit number issued to individual providers such as physicians or dentists, pharmacists, and also to healthcare organizations like group physician practices, hospitals, or nursing facilities, etc. So your book does talk about this when it's giving those CMS 1500 instructions. It talks about the NPI number. So it's important to know what this is. I want you to, for this next question, to use the NPI registry website here and find the NPI number for Douglas McDonald, who's an emergency medicine doctor living in Ohio. Okay. And I also want to talk to you about your SIM claims. Those are starting this week. So this week, in week 3, you have Chapter 11 SIM Claim Case 1-1 to do in MindTap. I wanted to let you know that there is more information on how to complete those SIM claims in Appendix I of your book in MindTap. So those give some really detailed instructions on completing those SIM claims. And again, your book, when you're going through the chapters, those give you detailed instructions on how to complete those claims as well. So for the SIM claims, there was previously an issue with it, but this should be fixed now. So if you go in here, and it's being a little slow today, so hopefully it loads. So week 3, you've got complete the Chapter 11 Sim Claim Case 1-1. Okay, so you're going to click on Start Assignment Now. It's giving me this error, but it still lets me take it, so I would just ignore that. It says, okay, take the test. Now, don't get stressed out because it's in test mode, and it looks really official, but you can actually go in and take that test as many times as you want. So you can go in and complete this claim form as many times as you would like to. Also, make sure you're clicking Show Case Study, because this is where it's going to give you all the information that you need to actually complete the claim. So this is the case study itself. You're taking this information and you're inputting it onto your claim below. And I can't show all of it here because it's kind of cutting off the screen. But so you have them, you're looking at the case study at top and then the CMS 1500 form below it where you're inputting the information from this case study. So when you submit this, it is going to actually show you with X's where you have input incorrect information or where you have missed information. So that's going to help you when you go back to your next attempts to remember to add that additional information or to change that information next time you input it. Make sure you're doing correct spacing according to the directions that are in your book, and make sure, so all that stuff needs to be correct. But again, you get unlimited attempts for this, and it will tell you where you need to make changes before you start your next attempt. Alrighty, everybody, thank you so much. Have a happy Halloween, and I will see you guys. I will have an office hour this week since we didn't have a live session, but I wanted you to be able to enjoy Halloween. So I will see you guys soon. Bye.